to describe the way that the stigma works. I think that word would be crushing.
You find that everything is covered up in cling film and all that, and you're like, why are they covering up all these things? And then you think, is it because I'm HIV?
Stigma is the killer in this disease. You can almost live with the disease, but you can't live with the stigma.
We have a right as any other person to be treated fairly.
Stigma.
I'm giving Stigma the index finger.
We've been involved in this amazing project over the last 8 months called the People Living with HIV Stigma Index rollout in the UK. It's taken me 6 months to be able to say that. But it's been an incredible experience, and we're here really just to kind of share some of the findings with you.
Essentially, the UK part of the project is the UK is the first country in Europe to work with the index, and this project this year has been funded by the MAC AIDS Foundation and also by the Scottish Government. And at the international level, that's the same thing. It's been part of a partnership between two international networks of people living with HIV, that's GMP Plus and ICW, between IPPF and also between UNAIDS.
The reason why we have a project specifically relating to stigma is that it's been increasingly recognised universally that stigma is one of the biggest barriers for people in accessing treatments, services, testing, supports, all sorts of other quality of life type things.
Some of the findings, 46% of people reported that their rights may have been abused in some way over the last 12 months. 17% of people reported having been denied health services in the last 12 months. That could have been dental, that could have been general practice, it could have been specific services, it was a general question, but 17% reported having been denied access.
As an organisation, we're really committed to providing quality health services particularly for the poor people and the most vulnerable and the most marginalised. So there's a correlation then with often around the world people who are vulnerable to HIV, and by providing services relating to HIV we can also improve our family planning services and reaching out to communities whose needs aren't getting met in other ways.
The process for developing this index began, if you all can picture this image, I said it was audience participation. I was in the shower and I thought about the fact that so much we speak about, even 5 years ago, about stigma, but it wasn't, we always know about healthcare provider attitudes and household surveys that measure stigma. I always use this example. If I said to you, please play audience participation in your head. If I said, would you drink out of this cup if I told you somebody with HIV had drunk from it? If you were hungry and I said to you, would you buy fruit from a fruit vendor downstairs who's HIV positive? So what do people say? They say yes, yes, because they've learned the response. Nobody ever asked people living with HIV, tell me your experience in the past 12 months. And I think that's what's important about this. This wasn't stigma that I may have experienced 20 years ago. This is in the last 12 months.
The most extreme form of stigma that I encountered during my research in Stigma Index was a lady who spoke on AIDS Day, and after disclosing her HIV status, the following day she found her car sprayed with graffiti of HIV and AIDS.
I've been on the receiving end of stigma on, two major occasions. The first one was absolutely horrific, and not long after I'd been diagnosed, and I'm an artist, I went on a painting course. It was quite an expensive one. I had paid for a private room, and when I got there I was told to share a room, so I said I would like, my private room because I have a few medical problems and I need my space. And the guy was American, and he just looked at me and said, have you got AIDS? And I said, no, I don't have AIDS actually, but I am HIV positive. So he said, in that case, I'd like you to leave right now. Picked my suitcase up, chucked it in the boot of his car, drove me to the bus station in Cadaqués and just left me there.
So, how did we do it? We interviewed 867 people from Aberdeen to Portsmouth, South, Mid, North Wales to East London. 35 community researchers were trained in London and Glasgow.
The questionnaire that's the central tool for the people living with HIV Stigma Index was formed in consultation over a couple of years. It originated from an idea that was then brought together a whole group of experts, and those experts were people living with HIV, were researchers, statisticians, human rights experts, healthcare providers, a whole group of people to look at the kinds of questions that should be included in this questionnaire.
A lot of people with HIV in the UK are researched out when they realised that it had the full backing of the UN and it was part of a global initiative. It had a different kind of buy-in, but I think the thing that really made it interesting for people was the fact that everybody that is on the project was living with direct experience of that moment when somebody had said to them, I'm afraid your test result's positive.
The reason I think this document is so important is, from my personal view, relates to a conversation I had earlier this year during the summer when I chatted to a health worker in the North West region where I'm from, and we discussed the problems he had had when his HIV status was diagnosed, which led to him leaving working for the NHS and never setting foot again in the hospital in which he worked. And what this document does, as far as I'm concerned, is give us the tools to argue with ministers and, more importantly, their officials that an education campaign is crucial, because stigma comes not from nastiness in the main, but from ignorance.
The one thing I'm very aware of as a gay man who lives with HIV is that when I enter into a sexual relationship with somebody, then one of the very first topics of conversation that we'll have is about my HIV status. And there have been a couple of occasions when someone has walked away, and that's fine.
One time I went for cervix smear, and this nurse put on very huge gloves, hard ones, 2 pairs of gloves, because I mentioned to her that I was HIV positive.
Thank you very much indeed for inviting me to what is a really powerful and important event. I'm called Jane Anderson, I'm a doctor. I've been working in the field of HIV from really sort of beginnings in the 1980s. And the way that medicine and science has moved forward, I really could not have thought possible when I started meeting people with AIDS back in 1982-83. And the idea that we would have had one day, one pill, once a day, that would allow people to remain in very good health, have babies, go to work, really wasn't something that I thought would be possible. But it is possible, and we do have that medical ability to do that. But the thing that doesn't change are the people. And the thing that allows us to take treatment forward is the people. And as long as people feel that they can't disclose or they can't test, then they're not going to be able to access the care that we've got. So why is this piece of research so important? Well, I think it's incredibly important that it has actually come from the people who've got the experience. And if we can actually hear the voices of the people who've got the experience, as you've done in this document, let's hope that takes things forward. Because until we do, I can't practice the sort of medicine that I would like, in the way that I would like, and get the sort of results that I would like.
A lot of people ask me if stigma in one place is different from stigma somewhere else, or if stigma for a woman is different from stigma for men, and I think what I really feel is that stigma is actually the same for anyone, and where you live or the colour of your skin or your sexual orientation will all be different barriers or opportunities for how you get over stigma, but stigma is a process that will impact individuals differently, but that process is the same for everybody around the world.
I would like to talk a little bit about how I come to be here talking to you. I had the opportunity to go to Cape Town in 2003. I was invited as one of the artists to perform for the launch of Nelson Mandela's 46664 HIV/AIDS Foundation. And after that, all the artists that were invited had the opportunity to go and visit clinics, hospitals, orphanages, townships and people's homes. And that experience of actually seeing people in their own situation struggling with the human face of HIV/AIDS had such a profound impact upon me that when I left Cape Town, I knew that I had to do something as an individual that's received so many benefits, and as a mother, that I had to give something back. And my horror really about the whole thing was that, you know, I've been aware of HIV since the early 80s in different capacities, and I've taken part in concerts that were about raising awareness and about raising money. But we were always thinking at that time, it's kind of ghettoized, it's about the gay community, it's about intravenous drug users, it's about sex workers. And actually, 2003 for me, South Africa, was the shift of awakening when I understood, wow, it's about mothers, and it's about children, and it's about the most vulnerable people.